So this is a quick video about health insurance plans, and some things that I wanted to try and explain are what a copay is, what a deductible is, what a coinsurance is, what an allowable is, and let's see, what else would there be, and your maximum out of pocket for the year. So deductible, it depends on your plan, but in most cases, a deductible is essentially the money that you have to spend before your insurance company pays anything for the year. So that is just money that you have to spend out of pocket before your insurance company contributes anything. Now, your employer may have a flexible spending account or a health reimbursement account or a health savings account that you can use to pay your deductible. So that can help because that's pre-tax money, and a lot of the times your employer contributes money to that fund. So I would look into that if you want to do that. But otherwise, remember, your deductible has to be paid before your insurance company pays anything. So if we are performing a service or a procedure on you, and it's the allowable is $1,000, and your deductible is $5,000, and you haven't paid anything down on your deductible, you essentially have to pay for that procedure out of pocket $1,000 because your insurance company is going to assume that you did that. And for us to say, don't worry, we'll bill your insurance company, it won't work because your insurance company knows how much money you've spent, and they're going to say, well, they haven't met their deductible, you have to collect the money from the patient directly until they meet their deductible. So you have to pay for the procedure out of pocket or with your FSA, HSA, or HRA, and then the insurance company will know, okay, they're $1,000 closer to meeting their deductible. So that's what your deductible is. That is what the insurance company expects you to spend out of pocket before they pay for anything. A copay is a small portion of the fee, it's usually relatively small, associated with a prescription or an office visit. So, your primary care visits may have a copay, your prescriptions may have a copay, your specialist visits may have a copay. So those are just a portion of those fees depending on your plan that you have to pay as a copay. So that's what a copay is. And in general, when you haven't met your deductible, you have to pay for those visits out of pocket because, again, your insurance probably doesn't kick in and pay for anything until you've met your deductible. So if a consult or an office visit is, say, $400 is what the allowable is, and you haven't met your deductible yet, you may have to pay for that entire office visit out of pocket. So that's kind of discussing the copay side of things. A coinsurance is a percentage of a service, be it a lab, an x-ray, imaging study, surgery, procedure, that you have to pay out of pocket. So let's say that we're doing a procedure and you've met your deductible and the procedure is $1,000 and you have a 20% coinsurance. Well, then you're expected to pay for 20% of that procedure, which would be $200 if it's a $1,000 procedure, and your insurance company would pay the other $800. Now, you quit paying your coinsurances once you've hit your out-of-pocket maximum. At that point, your insurance plan should pick up the costs for essentially almost anything and everything depending on your plan once you've met your out-of-pocket maximum. So in general, first you got to pay your deductible. Once you've met your deductible, your out-of-pocket expenses are going to drop somewhat. Then you just have copays, coinsurances until you've met your out-of-pocket maximum, and then your insurance company pays for most everything. As a private practice provider running a small business, as frustrated as patients tend to get with having to spend any money out of pocket, you have to understand that we are most likely an in-network provider. We take most insurance plans, and if you want to know if we take your insurance plan, just check our website or the North Florida Surgeon's website. So what I'm saying is we're probably in-network or a preferred provider for you, which means it's as good as it gets for you. I mean, that's as cheap and as low, I guess that's the best cost sharing you have, is to see a provider in your network, which we probably are. So in other words, and what that also means is we've accepted negotiated rates from your insurance provider, and those negotiated rates that we've accepted are assuming that you pay your deductible, your copays, your co-insurances, and things like that. So it's fraud if we don't attempt to collect those fees, your copay, deductible, co-insurances, because by law and by contract, we're expected to collect those portions of the cost from you. And so please work with us and understand that, if you're not paying that portion of your cost sharing, then you're essentially expecting a small business to subsidize your medical care. And that's not fair to us either, because your insurance company isn't going to pay anything until you've met your deductible. And if you're not paying anything out of pocket, then essentially I am personally subsidizing your health care, which isn't fair either. So be open with us. We'll work with you. We want you to be taken care of. But you have to understand that all health insurance has some cost sharing component, and so you will likely have some amount of out-of-pocket expenses, and that is just how health insurance works. If you want to learn more about health insurance, there's a couple places I'll refer you to. Number one is I have another video. I think it's called Open Enrollment 2020, or How Dr. Brown Selects His Health Plan or Health Insurance Plan, Open Enrollment 2020. It's on my YouTube channel. Basically, I walked through my thoughts and explained the different options when I had to select a health insurance plan for my family for 2020. So, I don't know. In that video, I kind of went through how the co-insurances and deductibles and all those things work, and how you can make informed decisions when you select your plan to choose a plan that fits the needs of you and your family the best. So there's more information about health insurance and understanding it in that video. Fair Health is also another great website, fairhealth.org or fairhealthconsumer.org. If you Google Fair, F-A-I-R space health, it'll come up. And that's a great resource that explains how health insurance works. It can estimate costs for you based on geography and CPT codes and whatnot. So those would be the two places I refer you to if you want to learn more about health insurance and how the cost sharing works. And lastly, we are more than happy to look over your health insurance plan with you. What we can do is, if you give us your health insurance card, if it's an up-to-date card, we can enter that information into a system we have called Availity. And within Availity, it will show us basically your current standing with your health insurance, meaning what amount of your deductible is left, how your plan works with regard to copays and co-insurances, what your out-of-pocket maximum is. And so we can kind of dig in and give you some answers if you give us your health insurance card and permission, obviously, to do this. We can give you some more information and kind of walk you through what your cost sharing would be for a given procedure. This isn't, also as a side note, I should mention, this is also why a lot of surgery gets done in November and December, because people have maxed out their deductibles and some people have maxed out their out-of-pocket maximum for the year. So they're trying to get in all of the elective procedures that they possibly can before the end of the year. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the Speak Pipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, and also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.